Hi, everyone. Thank you for coming to our training today, Sharing Power with Youth, Building Relationships Through Harm Reduction, brought to you in partnership between the Massachusetts Department of Public Health and Health Resources in Action, and through the Community Health Training Institute, funded by MADPH. We are excited to bring you this free training and hope that you will leave it with a better understanding of how to incorporate more harm reduction messaging and approaches into your work with young people. For those who have to leave the training early, please message my colleague Victoria in MF so she can send you our training evaluation link. We'll touch on this more at the end, but as someone who has now attended a CHDI training, we also welcome you to fill out a 5-minute survey that will help us strengthen our programming and ensure that our trainings meet your needs. Thank you so much for your feedback and your presence here today. I'll now pass it off to our facilitators, Gracie Rolfe and Anna Thorderson.
Thank you, Paula. Welcome, everyone. We are all here for the Training Power with Youth, Building Relationships Through Harm Reduction training. We're excited to be with you all today. We will get started with a few introductions, orient you to what we're going to be up to today, some learning guidelines, and then we will get started with the training, but we can move on to the introduction slide. So, I will introduce myself first and my co-facilitator, Gracie, and then we will go around and get to know all of you. So my name is Anna Thorderson. I use she, her pronouns. I am a program associate at HRA. I've been here for about 3 years. I've worked on a number of different projects. One of them was the Be Here project, which is where this training originated. So I helped to come up with this training, but full transparency, this is my first time doing the training and facilitating. So if you can give me any grace today, I would appreciate that. But luckily, I'm joined by my co-facilitator, Gracie, who is very well experienced in this. And I will pass it to her to introduce herself.
Thanks so much, Anna. Hi, folks. Good morning. Happy Tuesday. My name's Gracie Rolfe. I use she, her pronouns. I'm a senior manager in the training department at Health Resources in Action. I've been in that role for just over 7 years, doing lots of training and facilitation, mostly around behavioral health and substance use and overdose prevention, but other types of broad public health topics more broadly, and really excited. I helped write this training with Anna many years ago, and I think it's a really important and timely topic. I think there's a lot of intersection and overlap between positive youth development and harm reduction. And if folks don't already know, young people are going to use drugs, probably already are using drugs, and how can we empower people, A, to be safer, but also be less punitive in our messaging and in our approach to helping young people move through substance use if that's what they happen to be dealing with. So, and like all CHTI trainings, we're quite interactive. So Anna and I certainly welcome your voices in this space. We'll do some breakout rooms, we'll do some role plays, we'll do some brainstorms, but push back on ideas. Let us know if you have questions and thoughts, and really looking forward to our time together. And I'll pass it back to Anna.
Great, thank you. All right, so now we want to get to know all of you a little bit. So in the chat, if you could tell us your name, your pronouns, what brings you here to this training today, and any recent recommendations that you have. It could be a show, a book, a podcast, maybe a recipe, maybe some music, anything you want to share. And I'll kind of be reading them out as we go. So with that being said, if you go to the top of your screen, and it should say viewing Gracie Rolfe's screen, and you go over to the little drop down arrow right there and you press that, it should come up annotate. It'll be a little bar, there'll be a text box that you can click and then type in what you want, and it will show up on the screen. So we're going to practice this with one word that young people we work with or people in our lives would use to describe us. And thank you, Gracie, for putting those instructions in the chat. If you have any questions, or sometimes there's folks who annotate just does not work for them. If that is you, you can put it in the chat. We can put it onto the screen. There should be a little T with a text where you can type something in. So I see someone drawing, which is great. We love an artist. But it might be a little easier if you type it out. Oh, great, we have some popping up. So one word that young people would use to describe you, we have communicative, real, empathetic. Yeah, so it is at the top of your screen. It should say Gracie Rolfe, she, her, HRA, and then there's 3 little dots at the end of that. It should say view options, and then you click that and it'll go down to annotate. We also have Paula and Victoria here who are working on tech. So if you have any like specific questions on Zoom, they might be good to reach out to. Okay, we've got lots in the chat or on the screen. Kind, empathetic, present, committed, safe, consistent, cringe. I love that from my kids. You've got to be cringe sometimes. It's impossible not to. Kind, that's beautiful. Approachable, that's a great quality to have. We have 2 approachable people. I love that. Okay, responsive, a listener. That's great. Supportive. Oh, well, what a great group we have this morning. Um, this is great. Well, I think with that, if anybody has any further questions, we'll be using it once again in this training. If you can't figure it out, you can just put it in the chat and it will be okay. We'll make it up onto the screen. But I appreciate you guys doing this morning. So we can move on and make sure we clear the screen. Perfect. Okay. So, we're going to go through a few group agreements this morning. We are covering a topic that, you know, there's a lot of different experiences that we're coming into this space with. You know, people have different experiences in their own lives with young people around them. So we just want to make sure that we are considerate of all of those people. And so we're going to just have a few group agreements we're all going to agree to before we start this training. So the first one is take space, make space. I'm sure some of you have heard this before. I'm curious if there's somebody who wants to share what this means, how they've seen this happen in a training. Take space, make space. Feel free to come off mute or you can put it in the chat. If not, that's okay. We're still getting our coffee this morning. Oh, there we go. I hear someone.
It's kind of balancing, like, if I want to talk, but also leaving space for others to talk. So making sure that everybody gets to participate as well as you sharing what you want to share.
Yes, exactly. Thank you so much for sharing. Yeah, it's just making sure, you know, you have the opportunity to share whatever you are thinking, but if you are taking up a lot of space, we want to make sure that everyone has the same opportunity to share what they are thinking. So if you are, you know, a little bit quieter, but you have some ideas, we want to give you that space and make sure you have the opportunity to. And, you know, if you are talking a lot, we really enjoy that and we love that, but we just want to make sure everybody has that same opportunity. So, the next is be prepared to be called on and shared. We've kind of gone over this. We want this to be as interactive as possible. So we appreciate if you can share as much as you can. You guys are all bringing in your expertise into this room. And that is kind of, you know, one of the big points of this training is to share what our own experience is and our own expertise. And next we have the 4 virtual walls. So again, this topic can bring up a lot of different things, different experiences that people have had working with young people. We want to make sure, especially if we're all, you know, in the same region or the same work for a similar place, we take the message from what somebody says, but we leave all of the details. And I know you all maybe are working with young people, and so you know this very well, but we just want it to be said that we leave the details of what is said, but we can take the message. We want you all to be open-minded. We want you to be open-minded both with each other. We're all, coming to this from different perspectives, and maybe you work on harm reduction every day. This is super familiar for you, or maybe this is the first time you're hearing this. And so we want this to be a space of learning. So being open-minded with each other and also with the content that we are presenting. And then, as I mentioned, be mindful of lived and living experience. Um, Making sure that we're considerate about not everybody has our same experience, and making sure we are leaving space for those with different experiences. And I'm sure we're all familiar with this, but we just want to make sure we're not talking over each other. You can use the raise hand function if you want, if we have a lot of people who want to share. So before we get started, we just want to make sure everyone gives a thumbs up to these group agreements, virtual or via camera, thumbs up that we agree before we move on. Perfect. I see some thumbs up. Thank you all. Amazing, beautiful faces. Okay. And I think we are ready to go through our agenda for today. So right now we are doing our welcome and introductions. We will be together for 3 hours this morning, and going through all of these things. So we'll be defining youth development and harm reduction, figuring out what the connection is between those two things. We'll be playing a little game around data around youth and substance use, knowing the facts of those two things. We'll be exploring the ramifications of drug policy on youth, talking about the history, how we got to where we are, why this is the way it is. We will be giving you all a break. Don't worry, you will be getting about 10 minutes to stretch your legs, go do whatever you need to do, look away from the screen for a while. And we're going to come back with a decisional balance tool, kind of talking about how we talk to young people about changing their behavior, and we will close. And we want to make sure that we end on time. We will be asking if you can do, like Paula said, a short survey before we end. We just want to make sure that we're responsive to the needs of our participants. Does anybody have any questions about this today?
What time are we ending today?
We are ending
1 p.m. Eastern time.
Sorry, I'm located on the West Coast, and it just takes me a second to do the calculations, but
Thank you so much.
Of course. Okay, and we have some learning objectives to go through. I'm wondering if somebody would be willing to read some of these. I've been talking for a little bit. Could somebody read the first two on this slide here? Feel free to just come off of mute.
Sure, I can read. Define and link the concepts of adultism, youth development, and harm reduction. Practice using motivational interviewing strategies, including the decisional balance tool for talking to young people about substance use.
Beautiful, thank you. Yes, so we'll be talking about adultism, youth development, harm reduction, practicing using these skills, putting them into action. We also want you to understand the impact of the war on drugs on young people and how this has affected current drug policy. And then our last learning objective is to gain skills and rewrite policies to be more inclusive of harm reduction when working with young people. So if you all are working at an organization, how can we make those policies most inclusive? Does anybody have any questions about what we're here to do today? I don't think so. Okay. With that, I can pass it on to Gracie to get us started.
Thanks so much, Anna. All right, folks, we're going to get into it. I think if you've ever been to a training through the Community Health Training Institute or Health Resources in Action more broadly, you know that we like to sort of start very big and general and then get kind of more specific as our trainings go on. So I think it's really important to first ground us in some definitions of these concepts that we're going to be talking about today. So we've got harm reduction first. Does someone mind reading out loud these two bullets that sort of encompass the definition of harm reduction?
I can go. One
Thanks, Jennifer
practical,
Chan.
yeah, of course. One, practical strategies and ideas to reduce negative consequences associated with drug use. Two, movement for social justice, emphasizing the humanity, dignity, and autonomy of people who use drugs.
Thanks for reading those out loud, Jennifer. So I'll just let those sit and marinate, maybe for a few moments. But what do folks notice? Like, there are two, I wouldn't say very different things on the screen, but I see something that's one very like practical, public healthy approach, but then there's also this point and this definition about this broader kind of movement for social justice, for equity. But what are folks' reactions kind of reading these or hearing these read out loud? Yeah, go ahead, Justine.
Can you hear me?
There we go. We can hear
Okay,
you.
perfect.
Yep.
That it's more so acknowledging that drug use is going to happen and making sure that it's safe and that we're meeting people with dignity and understanding the underlying causes of drug use or substance abuse.
Beautiful. Love that. So I'm kind of reading in between the lines of what you said, Justine, but like people are going to use drugs kind of no matter what. People have used drugs for as long as humans have existed. And there are safer ways of using drugs for sure. And how can we meet people who are using drugs to empower them to maybe use a little bit safer, to give people options, but honoring, right, this humanity, dignity, and autonomy. Like, they're going to use them. People are going to use drugs. So how can we meet them where they're at and maybe help them along if they don't want to stay there and give them some options? I think that's really, really well said. Thank you, Justine. Other reactions from people looking at this definition? It's all right if we don't have reactions to the definition, but I wonder if folks can think of examples of harm reduction in action, whether that's with young people, something you do in your life, something you do with other clients or participants you might be working with. What are some examples of what this can look like in action? See if there's some stuff coming in the chat. Emily said Narcan distribution and fentanyl testing strips. That's great, Emily. You want to say more about that? I know about that, but I wonder if there might be folks on the screen who don't.
Sure. So I do substance use prevention, mostly focusing on youth, and that's alcohol and nicotine, but a lot of times because that's like the only substance use position in the towns that I work in, I do a lot of the Narcan distribution too. And I think Narcan is a really easy entry point to harm reduction for a lot of people because they come to Narcan trainings and they're curious about it and they want to like be prepared to help someone. And I think it shows them that like the theory of harm reduction and the point of view of these are just people who are struggling with something and we can't help them if they're suffering an overdose. So I think that's a really good entry point of harm reduction for some people. And the fentanyl testing strips is just a good example of like, if people are going to engage in a risky behavior, how can we make it less risky? Even though we know fentanyl testing strips aren't 100% all the time with the chocolate chip cookie example that Gracie knows about because I heard her talk about it a million times. But I think it's just like a good entry point, I guess.
Awesome. Yeah, thank you, Emily. So there's risk with any behavior, right? Like using drugs is risky. I don't think me and Anna are trying to come up here and be like, there's no risk associated with it. there's risk associated with a lot of behaviors, y'all. Like, anybody drove to work this morning? Yeah. Okay. Like, what's the first thing, hopefully the first thing you did when you got in your car? Someone's always like, I lit a cigarette first and turned on the radio.
Seatbelts.
Seatbelt.
Seatbelt, Airleys, Margaret, Wendy. Yeah, buckled. So, but you know, driving's not 100% safe, right? Like, there is a chance you could get into an accident, but that's why we have seatbelts. That's why we have traffic laws. That's why we have stop signs. That's why we have streetlights. That driving is not a 100% safe activity, but can we mitigate some of that risk? And I think that's what you all have alluded to really well. Not an exhaustive list by any means, but thinking both about some really practical things like medication for addiction treatment. So people actually taking prescribed medicine who have alcohol use disorder, who have opioid use disorder, taking medicine to treat this, just as anyone with any other chronic disease would take medicine to treat it. I take insulin if I have diabetes. I might take other medications if I have multiple sclerosis. I might take medications if I have cancer. Same thing. It's treating a disease that you might have. Wearing seatbelts, we just talked about this. Kind of more meta, and what we're going to talk about a little bit more today, non-punitive consequences, so not punishing people for their behaviors. But again, how can we meet people? And especially with youth and young adults, I can absolutely understand why we have rules, why we have policies in schools to help keep people safe. But how can we start to maybe move away from the really punitive approaches that I know I grew up with in middle school, high school, and even college. And then also, you know, using barriers during sex. Young people are going to have sex. Young people are going to use drugs. But that's why we offer people contraceptives and protective kind of measures, because we know that this is a behavior that they might engage in. Anything else that folks would add to this list? It's not exhaustive by any means, but anything else you would think is really important that you want folks to know about?
I think in helping keep them safe, some of the things that we talk about is they're going to do these things, but have a number to call if you don't feel like you can drive, or have somebody who's there safe that they can drive to support each other through this. And the feedback's been pretty good with the kids that we've spoken to of creating, like, not being in a position where you're going to have to get into a vehicle or you're going to have to get on a bike or something that can harm others and can harm yourself. Added in.
Yeah, I think that's great, Paula, and goes along with what Margaret said. What about using less, understanding? Is that ambivalence, Margaret? And not driving? I'm wondering if you want to say more.
Alcohol, beverage volume.
Alcohol, beverage volume.
By
Yeah.
volume, yeah.
Yeah, so understanding maybe some drinks are like more potent or strong in that way. Yeah, I think that's great. I'm just going up to what Erin Johnston said in this chat: supervised consumption sites / overdose prevention sites. I'm in a space where I can't talk at the moment, unfortunately. No worries. These sites are designated spaces where trained staff monitor people using drugs. Sometimes they have resources related to basic healthcare, housing, and recovery resources. Yes, overdose prevention centers, supervised consumption sites are a really beautiful example of harm reduction. I believe there are 2 that are legally sanctioned in the United States. There's 2 in New York, and I think there's 1 in Rhode Island. If it hasn't opened yet, it soon will be. So great examples. And Samantha sharing, for Massachusetts residents, you can get Narcan nasal spray and overdose prevention kit from UCAN, which is a resource of Health Resources in Action. Thanks for dropping that, Samantha. Beautiful. All right. Thank you, folks. So we're gonna pivot just slightly away from harm reduction, but in the same vein, want to define what youth development is. I wonder if there's another brave soul who wants to read out loud these two bullets for the group.
I can do it. A strengths-based approach to relationship building with youth. 2, emphasizes young people's autonomy, dignity, and right to self-determination.
Thanks so much, Jessica. So maybe some similarities, but why do folks, I mean, in thinking both about harm reduction and then reading this definition and seeing this definition of youth development, why do you think we need youth development or a youth development approach? Why is that important for us if we're working with young people? Go ahead, Emily.
I feel like the point number 2 emphasizes young people's autonomy, dignity, and right to self-determination is really important when working with youth because they spend a lot of time being told like what's expected of them and what they should be doing, and what like kind of we have laid out for them, especially in like the education system and stuff like that. So I feel like giving them some space to decide what they want to see and what would be effective for them is really important.
Beautiful. Thank you, Emily. Yeah. Young people are like told what to do all the time. I mean, I don't know if this has changed so much, but I was told when I could go to the bathroom in school, right? Like, what do you mean? I can't have control over my own like bodily functions. Like I have to go to the bathroom. What do you mean you're going to tell me I can't go to the bathroom? That's just like mind-boggling to think about. Jessica, I see that your hand is raised.
For the first one with the strengths-based approach to relationship building, if you're building your relationships on strengths, you're going to have a stronger relationship. You're going to build trust, and that's going to lead you into number 2.
Yeah, absolutely. I couldn't agree more, Jessica. I mean, if we're starting from a deficit perspective, right, and what people lack or what people don't have or what people don't do well, that is, excuse my language, shit for relationship building. Like you are not going to get anywhere, especially with young people around that. So I really appreciate that perspective. I see folks put some stuff in the chat. Youth are the best to speak about their own experiences. Exactly, Paula. As is anyone. Like people know themselves best, including young people. Allison said they locked the bathrooms in middle school. No one could go. That's just crazy, Allison. Like I actually like this, that boggles my mind so much, the stuff around bathrooms in schools and like telling young people when and where they can go, like it makes no sense. And I see there's a question from Say. Quick question, is the harm reduction movement centered on drug use specifically, or is the movement dedicated to other forms of harm reduction too? Great question, Say, and I hope I'm pronouncing your name correctly. Please let me know if I'm not. What do folks think to Say's question in the chat? Anybody brave? Go ahead, Paula. You got a thought?
Sorry. I think harm reduction, like kids are talking more about self-harm and alcohol, and there's so many things that just that cutting can lead to drugs, or they're all intertwined. At least that's just been my experience.
Thanks, Paula. Renee saying condoms are harm reduction. Margaret saying often used in substance use space, but can be applied to all sorts of behavior. Emily saying harm reduction, in my mind, applies to any risk reduction with any behavior. Yeah. Jessica, you want to say more?
I think harm reduction is, there's a huge umbrella for harm reduction. There are just many different subsets.
Yep. Thanks, Jessica. I would agree with what folks have said, and say to your original question, I would say that the origins of the movement of harm reduction, did not come from like public health people like me or Anna, but came from people who were using drugs, engaging in sex work, queer people of color, trans women, sex workers, drug users, and they came up with this movement while the federal government failed to act. really in the midst of the HIV/AIDS crisis that began in this country. Candace saying helmets, anything that reduces harm. Yeah. So I would say, there's little h, little r harm reduction, which are these very important public health strategies, like the helmets, like the condoms, like the needle exchange. And then I would say big H, big R harm reduction is really speaking about this movement, this social justice movement. That's how I like to think of it in my mind. Little h, little r, and big H, big R. So great question, Say. Thank you for that. Okay, folks, we're going to look at one more definition. Shay, thank you. Thank you, Shay. I appreciate that. So we're going to look at one more definition, and then we're actually going to send folks off into a breakout room to think about these concepts applied to a real life scenario. So we have one more definition, and this is related to thinking about adultism. And I wonder if there's one more person who's feeling brave who wants to come off mute and read this out loud.
Do it.
Thanks, Lauren. Go for it.
We use the word adultism to mean all those behaviors and attitudes which flow from the assumption that adults are better than young people and entitled to act upon young people in a myriad of ways without their agreement. John Bell, Director of Leadership Development, Youth Build.
Thanks for reading that, Lauren. So again, I'll just let that sit. I know the first time I saw that definition many years ago at this point, I was pretty floored. And there was a part of me that felt a little bit defensive as well, like as an adult at that time, a young adult at that time, albeit, but I had to sit with it. And I wonder what folks seeing this, reading this is coming up for you.
I have a thought.
Please,
I think,
Jennifer, go ahead.
yeah, I think when I was reading this quote, like a parallel discourse that popped into my mind is adultification of youth. I work with a lot of Black teens in particular, and I'm curious about what is the right balance to strike between like treating teens with like really deep respect, and also acknowledging that there are like reasonable limitations just like developmentally on like maybe life experiences that they have or haven't had yet. So I wonder what the right balance is of respect but also support.
Beautiful question, Jennifer. I think that's certainly something that popped into my mind when I first saw this. You want to value and treat young people not necessarily as equals, but that to do it in a developmentally appropriate way and to give them choice and autonomy. And sometimes, we need rules, we need regulations, we need to have things in place that maybe help young people stay safe, but how can we do it in a collaborative way as opposed to maybe doing these things without their agreement or without their input, I think is the balance. But Joanne, I see your hand is raised.
Yeah, I think the word that comes up for me instead of better is smarter, that adults think they are smarter than young people. And that's something that we all need to learn that we're not.
Yeah. So maybe the synonyms for better could be smarter. I certainly think that's encompassed in this as well, right? And there's an activity, I know one of our colleagues, Allison Shifley, is on this call, and Allison runs our youth worker certification training. And there's a section, I remember taking it, and there's an activity around should your youth in your youth program or your school create the budget of your organization. And it's sort of this spectrum of where people fall, like, yes, absolutely, like give it to them 100%. And then there's people on the other end thinking, absolutely not. Kids don't know anything about budgets. We shouldn't let them anywhere near them. And it's really interesting conversation that comes up. So yeah, I think there's a really deeply baked in assumption that adults are just smarter. Absolutely. Candy, I see your hand is raised.
I think maybe you mentioned that it's a balance, kids have or youth, they have so much that they could bring to the table.
Mm-hmm.
And I guess like also like their own experiences, some are made different, you know, because of what they've been exposed to, and they might have some maturity that their
Mm-hmm.
maturity level. It all depends on their maturity level, and they have, if we provide those spaces for them to provide with guidance, I think it's a good balance. So.
Yeah. Yeah, great point. I feel like I appreciate that, Candy. I think that leads into what Margaret had put in the chat. I think it's the assumption that we don't have anything to learn from youth. Absolutely. We have a lot to learn from young people. I feel like I've learned the most in my career as a social worker, as a public health practitioner, from young people and from people with lived and living experience. Emily said, I think as a young person, I looked to adults for guidance a lot, thinking they had a better idea of what I should be doing. Now, as an adult, I sometimes have no idea what guidance to give youth, and I see that a lot of adults around me also have no idea what we're doing. Yeah. Yes, Emily. Like, and it, I don't want to discredit, it can be coming from a good place. I think a lot of adults and youth workers come from a place of like deep care and deep like love and wanting the best for the young people that we're working with. And sometimes just the way how that comes out in practice isn't always, I think, as kind of good as it can be. So I really appreciate those sentiments. Alrighty, folks. So I'm just looking at the time, and I want to get us into this breakout room activity. And we're going to think about these concepts. And to you, they might still seem a little bit separate and not connected, but we're actually going to consider this scenario, and then we're going to look at some questions and have you answer those questions in relation to the scenario. Someone mind reading out loud this excerpt for us, titled Suspicious Smells? Okay, thank you so much, Emily Ludwig. You want to read this out loud for the group?
Sure. So it says you are a health teacher at a Massachusetts middle school. Your school's policy is that marijuana on the breath or person is a violation that carries a 10-day suspension and a recommended expulsion. Jordan is an 8th grade student in your first period health class. He enters class before the bell rings and takes his usual seat near the door. As class is starting, the principal comes into your room to drop off a form for you. She stops near Jordan, says she smells marijuana, and asks him to stand up. She sniffs his shirt and asks him to follow her to her office. You find out at lunch that Jordan was searched in the principal's office and no substances were found, but the principal and other administrators said they could still smell marijuana and he was suspended for 10 days. They are considering expulsion.
Thank you, Emily. Thanks for letting me call on you and read that out loud. So, this may not be an uncommon situation that might happen at schools. Paula has posted this, or sorry, Victoria has posted this in the chat. Thank you, Victoria, for doing that. And these are the questions that we want you to consider with your group. And you'll be put into groups, I would say, of maybe like 4 to 5 people, and you'll be in these rooms for about 7 minutes. But we want you to think about these 4 questions. It's totally okay if you don't get to all 4, but just to get our brains kind of turning a little bit. So in your group, discuss these questions about the scenario that we just read. How do you think the school's approach benefits Jordan? What about the rest of the school community? Number 2, how do you think the school's approach harms Jordan? And what about the rest of the school community? And what are some other ways to address a situation where a student may or may not be using substances? And does your approach change if you're in a school or a youth program? So just some things to get our brains going. So thinking about who benefits, who is harmed, is there another way to deal with this situation? And we'll see you all soon. Thanks, folks. All right, folks. I have a little debrief. Maybe Anna, if you wouldn't mind like annotating up just kind of ideas that groups have, but would love to hear from maybe 1 or 2 groups if there's anyone feeling brave. How'd you go about answering the questions and what did you discuss?
I'll go first.
Thanks,
So
Candy.
you're welcome. We actually just got to the first question.
Okay.
We weren't able to go to the rest, but so the first question is, how do you think the school's approach benefit Jordan? So as a whole, we thought that it really didn't benefit Jordan, that it would be best to build that trust before assuming, and to ask the questions before just jumping to it. Suspending might not be helpful. This doesn't bring a solution to the problem. So someone brought up that what is the policy? What is the policy if it's not on them? Like what is the consequences if, or what is the policy if they don't have the marijuana on them? It's not fair to just sniff their shirt and assume, based on just a sniffing. That's what the scenario said, that they just sniffed their shirt. And even if you're in a room where somebody else is using, it might just be on you, and assuming
right
that they are using based just on the smell of their shirt is not fair. And then what about the rest of the school community? It doesn't benefit the community if there's no clear guidelines for the rest of the community. Marijuana and breath is not clear. So that's up to where we got the end for us.
It sounds like you focus maybe more on question, like without going to question 2, thinking about how it's harming people, right? So it's harming Jordan in the sense that Jordan is not involved in these conversations. There's such a quick jump to, oh, your clothes smell like cannabis or marijuana, but not exploring maybe he lives with a parent who uses marijuana. Maybe he lives in a building. Maybe he has to walk to school and walks by people who are smoking or using marijuana. So there's any number of reasons. Yeah, absolutely. And also maybe, it's harming Jordan, like he's being taken out of school. He's missing his classwork. He's missing important time with his friends. And I really appreciate the thought as well, Candy and Candy's group. It's not clear to other students, right? It's a really ambiguous thing and it's not clear. And it's really important that we have transparency in our policies and practices and rules, and how they're implemented, right? It's not just, oh, today I feel like it, or it's very vague and ambiguous. Vague and ambiguous doesn't work for adults and doesn't work for young people either. I'm sure we all know that. So great thoughts, great sentiments from, I think that was room 2 that Candy was in. Thanks so much, Candy.
Thank you.
Any other thoughts from folks? Other questions we may have gotten to or ideas that came up?
Hey, Gracie, we talked about a lot of the same things, but we also talked about how humiliating a student isn't the best way to build a relationship with them, and thinking about how you have no idea, at least in this scenario, no idea what this person is going through, and how great it would be to empower them to be a part of their own solution to whatever issues they feel they have, so.
Yeah, definitely, Margaret. The humiliation that comes with singling out young people, discussing their substance use, and there's no, what kills me in this is there's no exploration of, if Jordan really is struggling with marijuana use and is using substances, he might be really struggling in the midst of that substance use. There's no conversation around, like, tell me what's going on. What do you feel like you're getting out of the cannabis use? Like, maybe it has to do with stress, anxiety, not fitting in at school. There's no room to explore any of that with this young person.
Or if he's not the user, and maybe he doesn't want to come to school smelling like marijuana,
Right.
And how can we be involved in solving that?
Yeah. Great. Thank you so much, Margaret. And Margaret's group. Go ahead, Samantha. I see your hand is raised.
Yeah, kind of jumping off of that, something that my group talked about a bit was the irony behind, like, if the student really was using marijuana, then pulling them out of school and taking them away from all of the resources that they were exposed to. So say there was an actual suspicion that for whatever reason they are engaging in substances or marijuana. Okay, well, now you've cut off connection from teachers, students, guidance counselors, any other resources they may have been getting at school by the expulsion, and not really getting to the root cause of
Right.
the situation at hand.
Yeah, absolutely. Strip it. Yeah, taking them away from a lot of those social nets or like resources that exist in schools. And there are really wonderful resources and ways that we can help students move through substance use. But yeah, we're denying them that opportunity. Jessica, I see your hand is raised. I'll give you the last word and then we'll keep it moving.
Well, you know, you have to wonder if you're going to create an ace by expelling a student. You know, the school or youth serving organization may be their only safe space. Home might not be a safe space for them. And, you know, especially if, you know, there's some substance use going on at home.
Yeah, definitely, Jessica. That's a great point. So we actually could be putting a student more in harm's way if they're only, you know, the only food that they get is at school, they're like healthy social relationships, good adult role models and figures, we might be taking all of that away. So great points that you folks all raise. I'm putting in the chat a link. This story, friends, we made some edits here and there, but this ultimately is based on a true story. This happened to a young person in Ohio, was almost, I don't think he was expelled, but he was suspended simply for smelling like marijuana. This is a Black student as well. We will talk a little bit about drug policy, war on drugs, the sort of racist implications of those and how those permeate schools to this day. But it's that, you know, it's not lost on me and Anna that of all the students in a school, they're singling out and targeting Black and brown students. Black and brown students, boys specifically, have higher rates of suspension, expulsion, disciplinary action, and that's not by accident, right? That's by design. Anna, anything that you want to add with this before we keep moving?
I don't think so. Yeah, I think you guys did a great job of thinking through all of the potential ways that it could harm the student and also the students around, you know, that are just observers of this. I think that's also
beautiful. All right, folks. Well done. Thank you very much. Great insights. I'm going to keep us moving and hand it back to Anna for.
Thank you. Thanks, Gracie. Okay, so we are going to get into a little activity around knowing the facts around young people and substance use. I think a lot of times there is sort of a narrative around young people and substance use that can be exaggerated in both directions of, you know, young people are using a lot, young people, you know, there's a lot that is said about young people and their drug use. And so we just want to do some level setting around what is the data around young people and substance use at this current point in time. So we can go to the next slide. We have a bit of a quiz for you all. This is not graded. We will not be tracking your points. This is just a for fun quiz, if those exist. So we're going to be putting some questions up on the screen. And we'll ask you guys to put your answer in the chat. We don't want you to worry about being wrong. It is okay to be wrong. It is okay to get these quiz questions. They also, you know, truth be told, there's not always a direct answer to these. So with all of that being said, we are going to get started. So yeah, we'll be asking you the question, we'll be putting up, you know, the findings that we have, and then we also want to bring you all into this conversation. you know, talk about what your experience is with this. Is this reflective of what you see? So, first question we have, is illicit substance use on the rise among young people today? So you can put whatever you think might be the answer into the chat. It's decreasing nationally. No, we've got a whole choir of no's. Decreasing. Okay, it seems to be pretty unanimous. Well, ding, ding, ding. The answer is it's a little nuanced. So, among 8th to 12th graders, cannabis and tobacco vaping use has increased in recent years. But all other illicit substance use is at an all-time low compared to the last 2 decades. So, admittedly, that was not as straightforward as we may have thought. But I'm wondering if you all have any thoughts. Is this in line with what you know about young people and substance use? Is this in line with, you know, what you've seen in your work? I'm curious what your reactions are.
Anna, isn't that kind of a convoluted question? Because in a lot of states right now, cannabis isn't considered illicit, unless I'm mistaken.
I mean, I think that's a really good point. I think that this was probably taken nationally, and maybe that's why that, you know, wording, but that's a really good point that, you know, cannabis. Well, I mean, and we are talking about young people who are 8th grade to 12th grade. So it probably would not be considered legal for them, but
It's
yeah,
not legal for them,
but it's not illicit.
but when the laws are decreasing and what they're reading about it
Mhm.
is saying, like in Massachusetts, they're saying, well, you can carry it. So
Mm.
there's, and I know I just asked a very loaded question because there's so many effects and there's so many addictions, but if the messaging that they're hearing, but I understand if this was taken, that helps me to frame this, that it was it's on a national rather than
Yeah.
statewide.
Yeah. I'm wondering if you have any reactions to this too, Paula.
Sorry, Anna, did you say me if I had anything?
Oh, no, I saw Samantha had her hand raised. So.
Oh, Samantha, go ahead.
It's not in direct response to what's being currently talked about, but
Oh, I think that's okay. You can.
okay. I was just gonna say it's really unfortunate because I feel like I don't know if the data actually backs this up or not, but I would assume that it would have been going down for a little bit, but then there was the market for like disposable vapes and like that type of a thing, and like the flavoring and stuff. It seemed really geared towards my generation. Like people were going away from smoking cigarettes a bit more, and then I know that it was designed to wean adults off of it, but then it kind of opened youth up to like, ooh, these flavored batteries. Like, so I think it's interesting to think about the different ways that these things can be consumed now as well, and how that's contributed to the increase possibly.
Yeah. I mean, for sure. I think that the vaping industry has done a very good job at marketing for young people. And, you know, the way that we have talked about it has changed over time too. Yeah, Gracie, did you have anything you wanted to add to that first comment? Or
I mean, I think it's important what you raise, Paula. And there's like nuance with, you know, cannabis might be legal in some states, not legal in others. What is the age that you're allowed to purchase? So but I think given that this is pulled nationally, I think that's why we framed the question the way we did. But I think there's, you know, there's a lot of nuance given that some states have more lenient laws than others. So I appreciate you bringing that up.
Anyone else? Any other reactions? I see in the chat. Karen says that your cannabis and nicotine has decreased. That's so interesting. I wonder if you have any thoughts as to why that might be. Curious if anybody has any news or increase with whippets. And yeah, I'm not sure. Emily says that they've seen an increase in them being available at local stores. So a lot of this is around like availability too, especially with, you know, marijuana or cannabis increases. There's a lot more availability in states where it became legal. Okay, I think we can move on to the next question. Okay, so of 20-year-olds who received abstinence-only education, sometimes referred to as DARE specifically, but this is just generally abstinence-only education around drug use during 6th grade. What percentage of those students in 6th grade were less likely to use illicit substances when they were 20 years old? I know that question is sort of wordy, so if you want me to repeat, let me know. Okay, we have 5%, 10%. We have some 10, 15 percentages. We have Samantha with people who went through DARE were more likely to use. Some more 10 and 15 percentages. Okay. So we have a little bit of variety, 10 to 15%, and then we also have Samantha, people who went through DARE were more likely to use. Okay, I think we can reveal the answer. So, does somebody want to read the answer out loud? Anybody can unmute Maria. Thank you.
Statistically significant percentage outside of tobacco use. And then do you want me to read the rest?
Yeah.
Okay. An influential meta-analysis published in the American Journal of Public Health in 1994 concluded that DARE's core curriculum effect on drug use relative wait.
I think it's supposed to say relative to the control. That's our bad. Maria.
Relative to the control schools is slight, and except for tobacco use is not statistically significant. Some studies saw a negative correlation between receiving a DARE education and self-confidence.
Thank you, Maria. So is this what you all expected? I'm putting a link in the chat if you are wanting to know more about this, and we'll go into a little bit of the history, but I'm curious people's reaction to this. There's no statistically significant percentage, and this was a big metadata analysis. And then there also have been some studies that have shown a negative correlation between receiving a DARE education and self-confidence later on.
Yeah, I will just share like a more personal story, but and he'd be fine with me sharing it. But my older brother, he's probably 12 years older. His class had DARE. I also went through DARE, but his best friend was the winner. They would always have that essay write up and you win a prize and whatnot. So his best friend was the winner, and then he ended up growing up and having severe substance use struggles. So right there just shows, the curriculum wasn't made to be sustainable for the years to come as they entered high school.
Yeah, thank you for sharing, Nicole. Yeah, I'm sure there's some people, many people in this room who went through DARE themselves, and I'm curious if anybody has, what it was like to receive an abstinence-only education when maybe you were using substances or you knew people around you as a young person.
I I'll chime in. I definitely went through the DARE when I was in elementary school. And I think it's just like any pathway to recovery or any education, it's going to vary. One pathway or one education model is not going to work for everyone. That's why we have multiple pathways to recovery, and how that I also identifies, when we think about person-centered trauma-informed care, and even when we think about trauma, we could experience the same traumatic event. Give an example, when we think of public health, the global pandemic and COVID-19, how it impacted all of us differently, right? And how we have some of us, have this new norm that we've adopted, right? And how we identify time before COVID, after COVID, right? Have some of us, return to in person, all of these things. So I think that's one of the things when we quantify data also, that there's always room for improvement based off participation and feedback and things like that. So to say that it wasn't successful, I think is not accurate. I think that it was successful for some, because my personal experience was, when I was offered a joint, I was like, this is my brain on drugs with the egg, right? Like that was like it scared me. But I also had lived experience in the home and all of these things, but I didn't participate because of the exposure and the commercial and the egg on drugs, right? I mean, the egg on the pan. So I think it goes back to each person, and just being aware of that and creating safe spaces. And that's why it's so important about making the connection with an individual and building the trust. So like that we could ultimately, have a conversation about how can we accompany the individual into what their recovery pathway looks like for them, and not dictating what that looks like for them.
Yeah. Yeah, that's a really good point, Arlise. I hope I'm saying your name right. That, we'll get into a little bit later, but about how important it is to understand each individual that you're teaching to, because there are a lot of people who probably reacted well to that kind of thing. And it's just about knowing the person that you're talking to and how you can talk to them in a way that's going to reach them best, through making connections and through, getting to know, their motivation. So I'm really glad that you brought that up. Joanne, I see that you have your hand raised.
Yeah, I think a part of what DARE did was to create a disconnect for many students involved with that, because parents may have been drinking alcohol, may have been smoking at the time. Smoking was a big thing for adults at that period of time as well. And so I'm being told how bad it is, but then I'm going home and I'm seeing a parent having a drink before dinner, or having a cigarette and things like that. So there was a little bit of a disconnect in terms of, so I can't do it. You're telling me no, but it's okay. It's the old do as I say, not as I do kind of thing. So I think that was a piece of what happened with some folks in DARE.
Yeah. Yeah, I think that's another good point. I think it is sort of limiting to just say, to not give students the tools to inform themselves. If it's just one way or the other, it's a little bit disingenuous to, the complexities of life. And so, when you see somebody using and they're okay, it's conflicting to this messaging that you might have heard. And we often underestimate young people's ability to make decisions for themselves if they have the best information available. And so if we give young people the tools to make those decisions, they're going to wind up making some better decisions. So I appreciate that, Joanne. Okay, we have just two more. We can move on to the next one. So this one, you might be very, very well aware of this, but are overdose deaths on the rise among young people? I'm seeing some yeses. Yes, yes, yes. Yes, question mark. Actually, no. Okay, so we have a little bit of not sure. That's hard, different from what we are reporting. So our answer, and I think we are also looking at this nationally, so if you might be in a specific region, it might be different. But yes, adolescent overdose deaths have more than doubled from 2010 to 2021. So I just want to sort of put that next to the question that we had earlier about illicit substance use being on the decline. So we're pretty much at an not all time, of the last 2 decades, we're at a very low point in terms of young people using substances. So I'm wondering if somebody can kind of fill in that gap for us. If young people are a lot less likely to use, but they are a lot more likely to pass away from an overdose, can somebody fill in that gap for us?
And I think that's a really, sorry, I think that's a really hard question. Because I'm the one who put we're doing different reporting. Is it comorbidity issues also? I mean, are we looking at if there's an overdose, could it have also been identified as a suicide? I mean, what are the factors in what we're looking at it? Because I don't, maybe I'm wrong, but I don't think there are straight, there in some cases there are straight overdose. I've certainly experienced that. But right, accident overdose. If somebody gets something laced, there's just so many more factors. If somebody has stopped using and all of a sudden they use again, then they're more likely to have an overdose. So I know I'm complicating things, but it was just a hard question for me to sort out to say definitively.
Yeah.
There's been what I was just going to say is there's been a dramatic increase in potency. And if an adolescent or a young person is just using something once in a great while, they don't have the tolerance for it. They don't know what they're doing. They don't know what they're taking. And so the risk is greater.
Yeah.
I'll add to that also. I think, you know, the substance that they're using and how the overdose is happening. A lot of, at least from my experience, a lot of it is not just heroin, but also pills. And when you look at pills, how they're being crushed in certain, it's not a scientist that's, saying, okay, the same percentage is going, of fentanyl is going in each pill. This is not, right? It's still, and so when they go to parties and things like that, and they have, just a bunch of pills, they don't really know what they're taking either. So I think that's a factor about, how they're using for social connections, all of these things, but then what they're actually consuming is really different. And something that, definitely a lot more education needs to be taking place and awareness. And when we look at social determinants of health, when we look at different populations, when we look at the data that they, are being impacted, there's a lot still, not only for, professionals, but also communities to be educated and informed in how to better support our young people.
Yeah. Yeah, you guys all brought up some good points. I'm hearing comorbidity, and then I'm also hearing that our drugs are a lot more potent these days. There's a lot more fentanyl in the drug supply. There's a lot more xylazine in the drug supply. And I'm also hearing sort of a lack of education around young people and maybe what they do in the case of an overdose, or if they know what substance they're taking. And I think that's exactly right. And I think Wendy, you articulated it very well, that, you know, our drug supply is a lot more potent and it's more likely that the drugs that someone's taking are going to be laced with something that the young person might not know about. And I think especially as a young person, if it's, you know, their first time, you know, trying something, they're not, you know, their body is not going to be able to handle that in any sort of way that might be the case for an older person. Okay, I think we are going to move on to our last question. So harm reduction is a newer concept among, I think, educators, a newer concept to kind of break into. And we have found some studies. So I'm curious what you all think, and this isn't necessarily going to be like a yes or no question, but you can, you know, share your personal experience if you have used harm reduction education, but how effective has this been in education settings? But I do want to preface that this is not going to be a yes or no, you know, straightforward. Okay, we have Nicole, very effective, provides skills and prevention education, very effective when done the right way, and significantly more than abstinence-based education, very effective. Effective for youth who may be at risk or already engaged in substance use. And then more effective, provides support systems and meets people where they're at. Okay, I think we can reveal. So what we found is that there's preliminary studies that have shown that developmentally appropriate harm reduction education increases students' knowledge, drug-related knowledge, and students were students were both less likely to consume substances and less likely to consume substances at harmful levels. So again, this is sort of a new thing, so it's being studied. I think there's some studies that have come out of Canada, which is, I believe, where this one is from. But I'm curious to know, you know, what your experience is with harm reduction education. It sounds like people have some experience in the room. And, you know, what the effect might be for young people who receive harm reduction education. Maybe we could have somebody who hasn't shared yet. I see there's some really good thoughts in the comment or in the chat.
I can speak. I think personally, like, I don't work directly with youth, but I think one thing that was happening before is the idea of youth seeing people using substances at home or older adults who they trusted and respected, and then they were being told that it would harm them or it was bad for them. So now it's more of like people can do these things, but understanding them and opening conversations up about them instead of portraying them as something that's going to harm them, and because that's not necessarily true, and it creates more of a trusting relationship between the educator and the student, because they're now not being told that this thing that they might try one day will harm them, when eventually they might try it and they won't get harmed, or, you know, depends, but they're gonna learn that on their own, so.
Yeah, I really like what you said about opening up the lines for communication and also creating like a safe relationship with the young person. I think that those are super effective tools to talk to young people about drug use. If it's not considered something that's like taboo or scary to talk about, it's something that, you know, you can have an open and ongoing conversation about. And also, you know, education is power. The more that we talk about these things, the more people are going to understand, that young people are going to understand, like, there are consequences. There are a lot of consequences to drug use. But also it might not, you know, result in this super scary, your brain is fried the first time that you ever use. And so there is something that is in between. And so when we can talk about that in between, it's going to become a lot more, you know, powerful for students. Okay, we have a little debrief. I know we've sort of been debriefing as we go, but I'm wondering if, you know, taking all of this in, is there anything that surprised you? And is there anything that might impact the way that you, I guess, approach your work? No surprises. That was all knowledge was already had. You can put, maybe if you want to put just a few words in the chat. Curious, are there any studies that show that teaching harm reduction works as primary prevention? That's a good question, Margaret. I'm not sure if anybody in the room has seen or has looked at those. Yeah, so maybe we're left with, you know, more questions than when we started about what this shows us. Okay, Gracie, is there anything that you have that you want to add before we move on to the next section?
I think I would just add, you know, take studies with a grain of salt, friends. They are capturing a moment in time of that specific time. Yes, things change. Yes, there are outliers. Yes, there are different experiences. But I would just keep that in the back of our minds. And Margaret, to your question about harm reduction being primary prevention, I think absolutely. Like what I would kind of educate young people on first and foremost is like abstinence, right? Like try to abstain and not use drugs if you can, especially for young people. We know that if young people are able to delay using substances until later in their teenage years, even later into like their early 20s, their risk for developing a substance use disorder goes astronomically down, way down. Even just the delay of a few years. So I think, you know, and I don't think harm reduction and abstinence have to be viewed as these two like opposing forces. I think they can be part of the same continuum. So I think absolutely like harm reduction can work as primary prevention. I would definitely say that. And hopefully I can find a study that backs up that question. But that's all I would add.
Thank you, Gracie. Okay, and with that, we have a break. So we are going to give you guys a 10-minute break. Please stand up, walk around, stretch, grab some water. Don't look at your laptop. And we will be back, I will say, at 45. Does that sound good? Okay, we will see you all then.
The recording is in progress. Great. So we're going to get into it. Anna and I have a work on a project that has a full 3-hour training on the history of the war on drugs. We're not really getting into too much of it today, but just as like a high level kind of, way that we can summarize it. We have these 3 points. Is there a brave soul that wants to read the 3 of these out loud for the group?
I can do it.
Thanks, Lauren. Go for it.
Sure. So brief history of the war on drugs. Number 1, criminalizing a health issue, substance use framed as a criminal activity rather than a health issue. Number 2, implementing racist policies, policies targeted Black and poor communities, racializing the issue. And number 3, permeating all institutions, influence the practices of all institutions, including schools.
Thanks so much, Lauren. I appreciate you reading that out loud. I know for me, I feel like sometimes schools are like a forgotten institution of how the war on drugs impacted many institutions and sectors and facets of our society. And I tend to forget that schools are included in that. And that's, the foundation of zero tolerance policies has war on drugs era tactics written all over it, right? This is actually not based in wanting to maybe, improve health and well-being for students or to keep students safe. That could be behind it, but the way that zero tolerance policies actually operate and impact students is incredibly detrimental. And we saw beginnings of that in one of the first activities we did already. But I wonder what, if you had to add anything to this list or expand on what is here, again, keeping in mind we're not doing a full deep dive into the war on drugs today. Anything coming up for folks thinking about this list, what you would add, how you might reframe some things? Go ahead, Joanne.
Yeah, I think one of the things that I think about is culture. That isn't a part of this. And I think about it in a lot of ways, but I have a large Arabic speaking population in my housing. And part of the culture there is something that doesn't necessarily fit with schools in terms of young boys and female teachers. And I think that that's something that we need to pay attention to. And while I think most of the families do not get involved with substances, there's still that opportunity for many of those children to be experimenting, and as well as then being singled out even more because of their culture. So that's one of the things that keeps popping up for me when I'm working with the families in my development.
Yeah, thanks, Joanne. And I think also culture influencing how different cultures might view substance use. It might be really accepted and embraced in some cultures, and traditional practices and ways of being, and in other cultures it might be highly stigmatized. Mental health might be highly stigmatized, and we know that substance use and mental health often intersect. So yeah, how do you kind of like balance all of those things, I think, is a really important point to consider. Anything else that folks have looking at these 3 kind of bullets? Again, it's not a all-encompassing deep dive into the war on drugs, but just wanted to kind of orient folks to this piece. But anything else coming up for people?
I'm sorry, but I'm not able to see what you're talking about.
Are you not seeing the slide?
No.
You're not seeing the slides, Candy? Are other folks seeing them? Okay. Candy, sometimes, I'm saying this lovingly, sometimes leaving a Zoom and coming back fixes about 90% of Zoom issues.
Okay.
I think, yeah, folks are seeing
back.
it. Okay, sorry about that, Candy.
No, you're good.
I wanted to make sure. I was like, oops, am I sharing the wrong screen? Wouldn't want that to happen. So let's get into zero tolerance. Another brave person want to read out loud this, maybe just an example of what a zero tolerance policy can look like.
I can do it.
Thanks, Erin. Go for it.
Problem. Any student who distributes or possesses any controlled substance, including but not limited to marijuana, cocaine, or heroin, on school premises or at a school-sponsored activity may be expelled or have a long-term suspension imposed by the principal.
Thanks, Erin. And this is, you know, a snapshot in time from a particular unnamed Massachusetts school district student handbook in 2020. It may have been updated since then. And also when we think broadly outside of Massachusetts, the stat on the right, 75% of US schools have zero tolerance policies. So there's no discussion, there's no wiggle room, there's no maybe consideration of a student's circumstances, environment, you know, home life, any of that. This is cut and dry, zero tolerance. We won't stand for this. And that's how it's going to be. 75% of US schools still have zero tolerance policies today in 2025. I know that 2020 was a long time ago. There may have been some updates in Massachusetts school districts, but I wonder, for the folks on the call who work in a school, if you have reflections, if you've noticed changes, or if this feels in line with what's going on.
Gracie, can I ask a question about this?
Go ahead, Paula. Yep.
There are two things. So from working with teachers that work in schools, there's in-school suspension, which I'm not as familiar with, but if a student is suspended, does anyone know about in-school suspension? Also, do parents have any say in what's going on? And especially with the first scenario, if a student is searched, do parents need to be there? Does another adult need to be there? So I don't know if those are relevant questions. But.
So I hear two questions, Paula. One is around in-school suspension and what does that actually entail? And then the second question is, are parents kind of informed or have a say or like are included in this decision that is being made? And specifically, I think I know the answer to the very last question you made around if a student is searched, does a parent have to be there? But any kind of like civil liberties or rights that we have go out of the window when we are on a school property. They can search your stuff. I've had my stuff searched when I was in high school. Like there is no right to anything that we are. I know this is a big topic right now, talking about what's in the Constitution and protections that people have. You don't have any of that on school grounds. That kind of goes out the window essentially. But do folks know what in-school suspension is, to Paula's first question? Any thoughts? Let me see, something might have come in the chat. Jennifer doesn't know. Okay, no worries, Jennifer. Maria said yes. Maria, you want to come off mute and share?
Yeah, just from I don't work in a school, but in high school we had in-school suspension. So throughout the day they would be in a classroom or a study hall and they would just be there in that room all day. They could do their homework or just try to teach themselves the material. So in-school suspension is just being in a separate classroom by yourself all day. Usually, sometimes there'll be other students that are also in-school suspension and they'll have a teacher there watching over them.
Yeah, thanks, Maria. That's and Emily said my school district does in-school suspensions as well. That's my understanding, Paula, is that you're completely isolated, like in a room by yourself, cut off from your peers, teachers. You're not participating in class, but you are in school. I don't know what that's supposed to do, but I'm not a school administrator, so there's a reason I didn't go into school administration, folks. And your second question, Paula, was around if parents are like involved in this kind of decision or kept afloat. I don't think I have a clear answer for that, but I wonder if people on the phone, on the call do. If students are going to be suspended, if there is, if parents have sort of not a say in that, but are kept up to speed about the decision and how it came to fruition. Anybody have thoughts on that, or a answer to that question that Paula had? My guess is it might depend, Paula, but I'm not sure. But I think it's important for parents to sort of be kept up to speed and, told about these situations, but I'm not really sure, and I'm not really sure if it's like a one size approach that everyone uses. So anything else coming up for folks looking at this definition before we keep it moving? All right, just wanted to share one piece of data. This is an analysis of National Household Education Survey from the Institute for Family Studies. Again, this is a bit dated at this point, but just trying to convey again who tends to be suspended, who tends to be expelled, who receives kind of disciplinary action in school. And from 2012 to 2016, this is looking across the US by race and Hispanic origin. And we see time and time again, Black students, specifically Black boys, are suspended and expelled at far higher rates than other races. And it goes up, right? It was very high in 2012 and it's a little less in 2016, but still the Black category is far and away higher than that of other races. And I feel like this correlates with what we talked about earlier, but just thinking about who is maybe receiving the brunt of these zero tolerance policies, and who is more likely to be suspended and expelled from schools. So,
and Gracie, I
might,
would say who is
go ahead,
also
Joanne.
more suspected to be involved, and may not have any. There may not be any reason at all, but they would be suspected.
Yes. So who's receiving the suspicion, the surveillance, has the assumption that they're doing something wrong. Absolutely. Yeah. Thanks for that, Joanne. So, zooming out, maybe on its face, zero tolerance policies might be coming from a good place, or we're trying to keep students, schools, whoever safe. But how do you think zero tolerance policies are impacting young people? Folks can come off mute, you can annotate up on the screen, you can put your thoughts in the chat, but how do zero tolerance policies impact young people? Folks can come off mute. You can put your thoughts in the chat. You can annotate up if you feel brave. Here we go. Someone said, keeps them from asking for help. Yes, absolutely. I think that's huge, right? Like, you could be really struggling, but if I'm in fear of the policy that my school has and what it will mean for me as a student and how it might impact my academics or my extracurriculars, why would I ask for help if I know that that's how it's going to go? Go ahead, Samantha.
Make sure I'm off mute. It leads to, the first thing I thought of was the school to prison pipeline. So zero tolerance policies obviously increase suspension. And that often leads to higher dropout rates and involvement in the criminal justice system. This is all like proven. So
Yep. So school to prison pipeline, if we're, if people are getting, young people are getting suspended, expelled, spending less time in school and more time out of school, like what does that mean for the trajectory that we're setting this young person up for? Some
does
folks have put,
disproportionately affect, sorry, I didn't mean to cut you off, but I
please go
do
ahead.
want to say it does disproportionately affect Black and brown students and minority populations.
Yep, absolutely. Thank you for that, Samantha. Someone said, personally, sorry, I'm just trying to move these around so we're not stacked on top of each other. Personally, I don't believe they positively impact youth. They are removing the potential of opening communications and building trust, in addition to being removed from resources that could benefit them. Yes, beautiful. Limits communication between youth and adults. Results in students being branded by the school when they are asking questions or are struggling. Absolutely. Really great points. Shay said in the chat, wonder if there is a similar trend with student self-confidence as there was with abstinence-based drug education. I think that's a great question, Shay. I don't know if we have a study we can pull out at the top of our heads, but I think you're onto something. There probably is a correlation between, low self-esteem, lack of self-confidence, lack of like healthy adult and young people relationships and role modeling that we see if we're taking people out of school. Absolutely.
I would also
Anna,
wonder if it has an impact on the relationship between the parents and the child as well.
Yep, for sure. I think it absolutely could, Joanne. There's a lot of routes and avenues that we could explore of how it's impacting different facets of a young person's life. So I think you're right on with that. Anna, was there anything you wanted to add to this before we keep it moving?
I don't have anything. No, thanks, Gracie.
Thank you. All right, folks, great thoughts. Just going to clear those, otherwise they keep going on to the next slide, but I think some of you alluded to these, so we can be kicked off sports teams for, having a positive drug screen or for being caught drinking or using drugs. Honor boards. Remember, young people can be up to 25, 26. Our colleague LJ would even say that young people can be 30 and over. So college students are young people, and having to meet with an honor board if you are drinking a lot or partying a lot. I will say for myself, as someone who had to go before an honor board in college, it was one of the most humiliating things I ever had to do. And it was very punitive based. I did not feel supported. It felt like you need to do these things or you're going to get kicked out. And of course I'm going to do it because I'm fearful, right? Not because it's actually like I had any participation in that plan. And there was no collaboration with me. There was no asking me my thoughts or what would work for me. It was very cut and dry. Not being allowed to attend programs, right? If you are like a youth worker and running a program, you might be subject to random drug testing, which I can imagine is incredibly humiliating. And automatic suspension or expulsion for possession of drugs. And we know that these are the real impacts. Loss of school time, breaking healthy adult bonds, not graduating or delays in graduation, increased likelihood of poor mental health outcomes, and increased likelihood of substance use. That's the kicker, right? If you have a zero tolerance policy to like dissuade substance use or like not allow kids to do it or think it's going to prevent it, this is actually having the opposite effect. So some really intense real impacts of zero tolerance policies that we see. Margaret put in the chat, I just want to call out, not as an excuse, but as context, that in my local school, and think this is true in most of the country, we have a shortage of teachers and subs and school staff generally. All of these best practices are staff intensive. How can coalitions support schools so that these best practices can be put in place when the staffing issues are not likely to be resolved soon? Oh, big question, Margaret. And I really appreciate you naming that. What do folks think? How can we support schools on these best practices, knowing that there's massive staffing shortages, teacher shortages? How can we kind of balance those two? Do folks have thoughts? How can coalitions support schools so that these best practices can be put in place? Any thoughts on that? Reactions, ideas? I don't think there's a right or wrong answer, friends. So someone's brave. I know someone's got a thought. There we go, Maria. Go for it.
Well, I'm just gonna talk through my thoughts out loud. I'm just thinking about how can we support young people in advocating for what they want to see. So it's not something that's necessarily coming from, oh, the staff need to do X, Y, and Z, but maybe the youth want to organize their own restorative justice circles, or they want to take charge in how they're going to respond to a case of, sorry, there's a lot of traffic outside. I don't know if you hear that. So it's not necessarily on the school or I guess like most of our effort is in investing in the leadership capacity of young people to support what they want to be doing.
Love that, Maria. So youth voice, youth input. I like Nicole's suggestion in the chat offering to be a partnership and possibly building a MOU, which is, I think, Memorandum of Understanding, where the coalition may provide the diversion program or provide training or sessions or something for staff to take part in. Or you're the entity that kind of helps move students through if they if they do break a policy, or can students help rewrite the policy, to Maria's point. So I think those are two things that were certainly in my mind. But a big question, Margaret. I appreciate you raising it. And I think there's stuff that we can do even in the midst of staffing shortages and teacher shortages. And Samantha said, look into legislation that has to do with school policy. Yeah, call your reps, call whoever, to see about how changes can be made there. I think that's great as well. All right, folks, I want to keep us moving and think about what comprehensive harm reduction and youth development policies can look like. How can we begin to shift some of these kind of punitive, negative, zero tolerance policy, war on drugs era school policies to actually be more comprehensive? So we're going to go into another breakout room. We're going to be with about 3 or 4 people. You'll be in these rooms, I would say, for about 8-ish minutes. And we're actually first going to do a stamp activity before we go into some breakout rooms. But you can use the annotate stamp function. So if you pull up the annotate bar, there's a little check mark that if you hover over it, it says stamp. And when you click the check mark, there's X's, there's hearts, there's question marks, there's stars. We're primarily going to be using this red X, and I'm putting the X's down on the bottom of the screen so people can see what they look like. Again, this is under annotate, and it's the stamp function where it should look like a little check mark. I'm going to clear these for now so we don't get all covered in X's. But on the next slide, using that stamp feature, we are going to stamp an X on parts of this policy that you think are not inclusive of harm reduction and or youth development. You'll get an opportunity to think through how you can go about changing the language in breakout rooms in just a little bit, but we're actually going to do this activity first. So can I get someone to read out loud this this policy that actually comes from an unnamed youth program that was sent to us. Someone mind reading this out loud for the group?
I can read it.
Thank you. Go for it.
Assessing policy from the unnamed youth program. According to our behavior management policy, possessing weapons, drugs, alcohol, or associated equipment will automatically result in suspension and/or termination of membership at the discretion of the executive director. We are committed to providing a safe, healthy, productive work environment to its employees and the youth it services. We recognize that drugs and/or alcohol abuse have a negative impact on the workplace and the organization's ability to fulfill its mission. Therefore, we are committed to maintaining a drug and alcohol-free workplace. We prohibit the unlawful manufacture, distribution, dispensation, possession, or use of drugs, including marijuana and alcohol, by individuals on its property or as part of any of its activities.
Thanks, Nicole. I know that was a mouthful. I appreciate you reading that out loud. Kind of redundant to a certain point. That's just my 2 cents. But I want y'all to have at it with the X's. Slap some X's up on what you see on the screen that you think this is not in line with youth development. This is actually not in line with harm reduction. This would do more harm than good. What do folks think? Go ahead, and I'll give folks a few minutes to do that. All right, so we're seeing stuff on automatically. Don't like that. Suspension. Don't like that. Termination. So, being let go from the program. People seem to not like at the discretion of the executive director. Yeah, that seems like it's all the power and decision making is up to one person, which isn't really in line with youth development or harm reduction. If we can jog our brains back to those definitions. The word abuse, people weren't liking. The kind of cut and dry prohibit abuse, stuff like that. I'll give it like 10 more seconds. All right. So there's a lot there that I see that folks were not a fan of. And so I'm going to clear this now. We're still going to look at this in our breakout rooms. And this is actually when we're going to go into the breakout rooms this time. Thanks for letting me. I was keeping you on your toes to see if we were going to do it just then or do a little activity before. So we're going to go into some breakout rooms now. I'd say just about 8 minutes, maybe. You are going to look at this policy, which will be shared on the slides into your breakout rooms. And we want you to attempt to rewrite this policy or think about language that you could change to make this policy a little bit more inclusive of harm reduction, youth development, less punitive, et cetera, et cetera. Okay? That's all we're really tasking you to do. It doesn't have to be, you don't have to write pages. You can actually just take notes as a group. But be prepared to kind of share back what you all discussed and if you were able to update some of that language. Does that make sense to folks? Are there any questions? Clarification? Thank you, Victoria, for putting the slide into the chat. Anybody need clarification before we send you off into breakout rooms? Whoops, and I'll actually look at got some more questions on the next slide, so I'll share this into the breakout rooms. All right, I think we're all good. We'll see you in about 8 minutes. Thanks, folks. All right, folks.
Already.
There we go. The participant list is shooting back up. Thanks, everyone. Sorry if we cut off conversation. I know the 10-second countdown is ominous and feels daunting, but we'd love to hear maybe from one or two one or two groups or anyone who's feeling brave, tell us what you changed and how did you make this policy more encompassing of youth development and harm reduction? And I'll go back to the policy itself. Any brave souls?
Something that we discussed in our group is automatically at the discretion of the executive director, but also it says it's rather than our, so creating a space for young people. And when we say at the discretion of the executive director, why isn't there somebody from other, like maybe a supervisor or human resources, somebody there? And also there's not a place for them to ask questions and to take ownership of this. And Justine can talk, but also it doesn't say anything about if you feel threatened in the workplace or sexual assault or anything. Nothing about that was brought up.
Thanks, Paula. I think this policy itself may just be the one that focuses on substance use. I wonder if this program had other policies relating to, harassment, sexual assault. I'm sure. Yeah. Joanne, give me one minute. I just want to read what I see Nicole put in the chat. So based on Nicole's group, what they came up with, we're committed to providing a safe, healthy, productive work environment to its employees and the youth it serves. Services. We recognize that drugs or alcohol use can have an impact on the workplace and the organization's ability to fulfill its mission. If a situation involving substances arises, we will provide support and necessary resources for a positive outcome. Love that last sentence, right? It doesn't feel cut and dry. It's not punitive. It sounds very individualized, like we will take it as it comes and can't, someone might have a more serious situation than others. And it sounds like Samantha's group had something very similar. So beautiful to hear. Joanne, over to you.
Yeah, so our group did too. And then we went to number 3 and decided that number 3 should be number 1 and that there shouldn't be a policy that is already written, that the young people should be working with the staff to create a policy as opposed to handing one to them to rewrite. So that's kind of where we and what's been stated in the chat and was a lot of the language that we were thinking about as well. But it felt like it was way after the fact that here's this policy, what do you want to do about it? As opposed to help us write the policy that's going to work.
Yeah. So more of a collaborative effort and less of, we've already made it, we want you to proofread it and see if you have any thoughts. But how can we come together, both adults and young people, and write this together? And I like what you said, Paula, about like even referring it to the center or the school or the program as it's ours, right? It's all of ours. It's not just one person's, it's not just an entity that exists, but it's something that we all participate in. I think that's really great. Any other thoughts from folks? One thing Anna and I just wanted to share, this comes from what parts of a youth policy and program can look like. This is from the Center in New York City, which is an outpatient substance use treatment program that's for youth. It's designed for LGBTQ young people ages 13 to 25. And really, it's a program focused on helping these young people make informed decisions about drugs and alcohol using this model called the 7 Challenges that come from Robert Schwiebel. And it's I think, very in line with harm reduction and youth development. So talking openly and honestly about ourselves and alcohol and drugs, looking at what you liked and what you didn't like about your substance use, looked at our use of alcohol and other drugs to see if it had caused harm or could cause harm, thinking about our responsibility and the responsibility of others. We thought about where we seemed to be headed, where we wanted to go and what we wanted to accomplish, made thoughtful decisions about our lives, and we followed through on our decisions. If we saw problems, we went back to earlier challenges and mastered them. So in a way, this almost feels like a combination of some policy, zero tolerance policy being rewritten it also feels like a new take on like 12-step programming, which I think can bake in some shame and some not great feeling for people. I know 12-step programming can be really helpful for many people. And for young people, it might not always land. And I think this is like a reframing of that. So just wanted to offer that at what something like that can look like. Anna, anything you want to add to this point before we get into our last piece?
I don't think so. Thanks, Gracie.
All right, folks, I'm mindful of time. Want to keep us moving along? And I'll kick it back over to Anna.
Thank you. Okay, well, we've made it to our last section. We're going to be talking about decisional balance and change talk. So this is sort of a method that we can use when we're talking to a young person who might be using a substance in a way that is like a tool to really reach them and to have them speak into existence, why they are using a substance, what it's doing for them, and also how they see best to make a change in their life. So this is a nice visualization of this decisional balance tool. So the decisional balance tool is a frequently used motivational strategy, particularly when a client is displaying ambivalence about making a change in their life. And it's a useful way of determining their stage of change in regards to their behavior. So in a way, it helps the young person pull out what they might be feeling about this behavior. And it's almost as if you're asking them to, come up with the reasons why they're using, but also come up with the pros and cons associated with making that change and what it would require of them to make the change. So on the next slide, we have a lovely little quadrant, and this itself is the tool. So you'll see we have kind of 4 quadrants here, and this is how we work through making the change. So I think a lot of times as a professional who does this work, you might want to feel like the spokesperson for change. And you might want to feel like, oh, if I just give them all of the information, if I tell them to make this change and I give them the information, then that change should be automatic. But I think, as we can all recall, being 16 years old, somebody telling us what to do, our automatic reaction might not be to just do what that person tells us to do. So going through this, the young person might come to the same conclusion that you were going to come to, if you had just told them, but it's going to be a lot more powerful if that comes from their own words and their own voice. And it also kind of helps them understand why they are engaging in this behavior, in what ways it's harming them. So we've got the benefits of not changing. This is where we start. We're going to go in a counterclockwise manner. So starting with the benefits of not changing, the cost of not changing, and we have the cost of changing, and we end with the benefits of changing. So we're ending with this kind of uplifting thing that's saying, what are the benefits that this is going to bring to my life if I do make this change? So I think we're going to work through this as a group one time, coming up with the reasons that a young person might give for each of these 4 quadrants and kind of, leading them to this conclusion, or what are the benefits of changing this behavior. So I'm wondering if anybody can put in the chat an example that you might have with a young person. And it doesn't have to be like a big example. It can be a small change that a young person might want to make. But what is an example of a conversation that you would have with a young person where, we're hoping that they might make a change in their behavior? You can put it in the chat, shout it out. No one? That's okay. Okay, Samantha, this is wonderful. They've been vaping at school. I think this is something that a lot of people are probably dealing with, is how to respond to young people vaping at school or at like an outside activity. So I'm going to ask you all to kind of work through this as a large group all together. We're going to start with what a young person might say are the benefits of not changing. So why would somebody want to continue to vape at the same rate that they are currently vaping at? You can just shout them out.
To fit in with their friends.
To fit in with their friends, yeah, social pressure. Socializing, yeah. You know, if all of their friends are doing it, it's a way to fit in. Yeah, and it might be something like maybe they're feeling anxious. Maybe they're using it as a way to maybe manage their anxiety or something like that. Okay, next we have, what is the cost of not changing? So what's the cost of using or of vaping at the current amount? Potential addiction. Health impacts. Thanks, Samantha. Yes. It costs a lot of money. It does cost a lot of money. Yeah, financial. Yeah, as a young person, you know, you don't want to be spending all of your money on doing this. Could lead to getting in trouble at school. Yeah. Consequences at school, at work, at outside activities, which could lead to discipline and other consequences. Yeah, that's great. Okay, and then we have the cost of changing. So what would it cost you to use less? And I think that, or to stop using, or to find another way to manage your anxiety or your social skills. What would the cost be of making this change? Yeah, you might lose friends. There might be social consequences. You would go through withdrawals. Yeah, the health impacts of stopping. Withdrawal symptoms, yeah. Anxiety, yeah. You know, if you're using this, you know, as a tool, then maybe whatever you're using it to manage could come back up. Yeah, these are great. And then we're going to end with the benefits of changing. What would the benefit bring to your life if you did change this behavior? Better health. Yeah, maybe you can run more in your gym class without getting winded. Save money. More focus on school. These are great, yeah. New friends. Yeah, it doesn't always have to be this loss. You know, what are the new things that it could bring into your life? Maybe you would become less anxious. It would feel good to accomplish something that's hard. It would bring a sense of accomplishment to your life to do this. Less reliant on something outside of yourself. Yeah, learning to trust yourself. Empowerment. Yeah, I think that's a really great point. You know, learning to change a behavior is very hard, and so you would feel this sense of accomplishment after. Empowerment. These are great. Okay. Yeah, I think you guys have kind of gotten the hang of how to talk through this change process. So, you know, if somebody is sort of ambivalent about making the change, going through this, asking not just like, why are you doing this? But what benefit is it bringing to your life? Because there's, you know, with every behavior, there is some benefit that it's bringing to your life, and it's worth acknowledging that and then being able to say, well, what would it cost you? And what is the benefit of making that change? So I think it's a really great way of working through all of that. And I think sometimes as young people, it's important to, learn to express yourself and think through these things. Sometimes you might just be doing it because your friend's doing it. But if you really think through it and understand your motivations, it's easier to kind of recognize what it would take for you to make that change. So thank you guys for all walking through this with me. Gracie, about the decisional balance tool, do you have anything you want to add?
I think that was really great, Anna. I don't know if there's too much, but I mean, I'll literally like write it down and like I've sat with someone before and we've mapped it out together. And I think this kind of counterclockwise approach, so you end like the young person or the client or participant, they are ending themselves like saying what are the benefits of the change. That's the last thing that they're saying, and they're coming up with it themselves. It's not like I'm filling it in for them, but these are things that they are saying themselves. And I think that's why decisional balance, in essence, it's just a pros and cons list, but kind of a deeper exploration of that. So, but I think great job, Anna. Nothing too much to add.
Yeah. And I do think there's also a benefit in, taking what somebody says and sort of repeating it back to them just to make sure you understand. And also just so that person hears, their motivations and their words spoken back in a way, to create understanding between the two people. So I think it's a great method for that. So speaking of change, we're going to talk about change talk. So just gotta wait for it. There we go. So the way that we talk about change is also really important. Having them come up with this change on their own, but also the way that you're asking questions, the way that you're engaging with this person is also important in how they establish a change in their life. So I'm wondering if there is a brave and lovely soul who would be willing to read these, or the first 3 sentences on this page. Your client is ambivalent. Anybody want to read these out loud? Wendy, would you be willing to? No. Maybe not.
I can
Paula?
read it, Anna.
Oh, okay, great. Thank you, Margaret.
Change talk. Your client is ambivalent. You simply want to seek to understand the ambivalence. Avoid any temptation to give helpful information or advice. Initially ask, would it be all right with you if we talked for a little bit about your vaping, let's say? If yes, ask, tell me about your issue. What are some of the good things about it, about the vaping, and the not so good things? And then respond with reflective statements.
Beautiful. Thank you, Margaret. Yeah, so this is a little bit about what we talked about before, but you want to avoid just giving information. You want to ask and, enter into the conversation with the young person. Say, is it all right if we talk about this right now? And I think responding with reflective statements is sort of what I was getting at earlier, is just responding with what you hear, what are the messages that you're hearing from this young person, just to make sure you are on the same page, and also just so the young person can hear, their messages spoken back to them. I think that can be powerful as a young person to hear an adult, speak words to what you're feeling. So we have some examples of questions on this page. So if you were to stop vaping or whatever this behavior is, why would you want to make this change? What are the 3 best reasons to make this change? And also, how might you go about it in order to succeed? And then on a scale from 0 to 10, how important would you say it is for you to make this change, and why not a 0? So just really understanding why this person is engaging in this behavior, what they see as the steps that would be necessary to have them make this change, and how you can be of service to helping them move on to make this change. And with that, we are going to use sort of what we just talked about, and we're going to give you all the opportunity to work through these yourself. So we are going to put you into groups of 3, and we're going to give you some scenarios in which you might be at an opportunity to use these skills of a decisional balance tool, kind of making this change talk. And we're going to ask you to put these to work. And of course, this is a learning environment. It's low pressure, low stress. You can make mistakes, but we just want to I think it's important to get into the routine of having this mindset of learning somebody's motivations, and being able to walk them through, their motivations and how they would go about making this change. So we have 2 scenarios for you. Scenario 1, there's a young person who has been working at your youth program as a mentor for the past 6 months. They enjoy the work, but have received a warning for showing up to work high. This young person has a lot going on in their family and was just evicted from their apartment, and they're staying with friends. With all of this going on, they seem to be disconnected from their work. You value them, you want them to be able to stay in the program, but do not want them to receive further warnings for the substance use, and you are also concerned about how they are handling these challenges in their life. So we're going to ask the first person, the person in your group who has the shortest hair, you're going to be the young person with the longest hair. You are going to be sort of the guidance counselor, or, the adult in the situation. And person with medium length hair, you're going to observe, and then your switch roles for this second role play. Scenario 2, you are a youth worker at a job readiness youth program that has been serving young people aged 16 to 24. A youth who you recently or regularly interact with has been abstaining from substance use since a recent DUI caused them to lose their license. They have remained at the youth program but have started to vape regularly, which is against your agency's policy. You have attempted to remind the youth about this policy several times before. The youth expresses to you that vaping has helped them abstain from other drugs and also helps them as a coping tool for stress. So with this, we're going to switch all of the roles, make sure that the person who observed in the first role has a role in the second one. Do we have any questions before we get started? No? Okay. I think we are ready to get going. I appreciate all of you who stayed and were willing to try this role play. We are almost at the end, so we're going to do a quick little debrief from this, and then we will start our closing. So I want to hear in just 30 seconds from maybe 2 groups. How did that go? What went well? What was challenging? And what do you still need guidance on? Yeah, so I'm curious if anybody wants to share. I can call in some groups.
Anna, our little group was great. It went well. We only got through 1, so not everyone had a turn, but our observer, it sounds like they do this all the time. So it was good to have them observe and give us feedback. I think just more practice, just need more practice. And it's not a situation I'm in very often, but it's a good skill to have. Speaking for myself.
Yeah. Thank you, Margaret. Yeah, I think practice is very important for establishing these skills, with your coworkers, just whenever you want to do a role play, practice these skills. Anybody else, any other thoughts about how this went?
I'm not in these scenarios. I'm not in these situations often either, but I think also keeping like an open mind. And I really like this. I'm going to start working more often with youth now, so I'm glad that I'm being exposed to this conversation, and just having the tools of, you know, how to really reframe their thought or guide them through a process that will help them get to like the benefits of making those changes. So I think it was a great practice for us today.
Great. Thank you, Candy. Yeah, thank you guys for sharing. And apologies, we were kind of running up against the clock here, so I don't think I'm sure not all of you got to both situations, but good practice nonetheless. So we can move on. We have just one more slide for you. Just want to go over the core principles of working with young people. So these are just, you know, the things that we want to keep in mind, we want to take away from this training. We really want to listen to young people. They have a lot to say. We want to value their voice and who they are. And we also want to emphasize it's okay to have high expectations for young people. We want to set them up for success, of course, but we also want to, you know, not sell them short and, you know, give them the tools to meet those expectations, but it's okay to expect a lot from young people. I think they're very eager to rise to the occasion. We also know that young people, they have some great ideas for leadership, and giving them the tools to be leaders in your organization, be leaders of their own life, is a great way for them to start practicing these skills and be authentic. We know that young people can sense the pardon my language, the BS from adults in their life. So we want to be true to ourselves so that they feel safe to do the same. And exercise understanding. I know being young is very difficult, and so just being understanding of them and where they're at. And with all of that, we are closing it out. If you wouldn't mind just putting one word that describes something you're taking away from this training, something you want to remember going on throughout your day, throughout your week, throughout your month. We will be closing it out. Thank you guys for sticking with us to the end. We will be sending these slides out to you all, and if you have any questions, we'll also be sending Gracie and I's contact information out. And I'll pass it to Victoria to do our final closing.